All right, young lady, can you tell me your name and where you're from and introduce this young man next to you here?
My name is Sue. I'm from Blanc, Michigan, and this is my husband, Tim.
Awesome. Now, you came here approximately, 3 months ago. Why don't you tell us why you came in, what kind of problems you were having?
I had very, very bad neuropathy in my feet. I had chemo treatments back when I had breast cancer, and the neuropathy was getting worse. I'd had it for 3 years, and I saw a seminar advertised, so I thought, I'm going to go. So.
Yeah, so you went to that seminar. Now, let me ask you this. Were you both at the seminar?
Yes.
You were. What did you think of the seminar? Were you skeptical? Were you comfortable? Were you kind of wondering?
No.
What were your thoughts on it?
No, I was anything that I thought when I saw the people talking and they had results, I thought it's going to be testimonials. I thought that I'm going to go for it because nothing else has worked. My doctors, what they've been doing for me, had not worked.
And you were, like I said, you were suffering for about 3 years. Okay. Then you went to the seminar and then you came in here, we did a screening on you and everything else. And we found out that you had some damage and we thought we would be able to help you. Besides all of that, what other health issues were you having at that time?
I had just been diagnosed as diabetic in December, and I was having weight problems and this and that, so in very, very, very bad pain with my feet. I couldn't sleep.
Yeah, tell me about the sleep. Like, what was the big issue with that?
Wake up, my feet would hurt. I'd have shooting pains. I'd have to sit on the edge of my bed, shake my feet, and I'd be lucky to get 2 hours of sleep, and the pills that the doctor was giving me wasn't working.
So you were getting 2 hours of sleep. How was your day the next day?
I was working at the time, and it was
Lord.
hard, yeah.
I bet by the end of the day you were exhausted.
Oh, yeah, I was in bed by probably 8 o'clock and then up again all night again.
Trying to get some kind of sleep of some sort.
Right.
How was your energy level throughout the day?
Low.
Yeah.
Luckily, I had a job where I would sit at a desk, so I didn't have to run around.
Yeah, it made it a little bit easier for you,
right.
huh? All right, so when you started care, how long did it take before you noticed a change?
Just a few weeks.
Within a few weeks,
Yeah.
you were noticing some changes.
Yes.
And like I said, now it's been 3 months. Has there been any changes noticeable?
Oh, plenty of changes. Lots and lots and lots of changes. I have no pain. I'm sleeping through the night.
How many hours are you getting of sleep now?
Usually about 6-7 hours a night.
And you're not waking up anymore?
No, not at all. And I'm able to go to sleep at night. My feet aren't hurting. I don't have the shooting pains. I've had really good results with the diabetes, controlling that, and my diet. I went down quite a few sizes. I've lost like 50 pounds. And
yeah, so we helped you with that since you also had,
yes.
They told you, from the chemo that started, you had some blood sugar issues, so we put you on a protocol of changing the way you eat and everything else, and as a result, you said you lost how much weight?
50 pounds.
50 pounds?
50 pounds, and then my A1C, I brought it down from 9.4 to 5.7. So.
And your doctor, as a result of all that, are they making any?
He took me off one of my medications for my diabetes. Yes.
And you still got a ways to go,
yes,
right?
But I'm working on getting all the rest of them down.
So now it's just a matter of time. We were talking about that earlier, and they're willing to work with you.
Right.
You're going to be able to make some changes. How's your energy through the day?
A lot more. I've retired too, so that makes a difference. But I do have a lot more energy.
Yeah. What percentage are you seeing?
Oh, 90%.
Oh, yeah.
You see her more active now at the house and able to do stuff without struggling?
Sure. I mean, there's no way that she would have ever thought about getting in a hot tub with her feet touching the water. But now she's in and out of the hot tub. We actually bought bikes now that's for her to ride that's comfortable, and she's doing that. We've taken grandkids on outings and
You were
going
saying
to the zoo and
you went to the zoo. Is that correct?
walked around them all day with them there.
Would you have been able to do that, say,
No.
3-4 months ago?
I had troubles just walking into the grocery store
Definitely
before.
not. Oh, right. Yeah, because there was times where I had to go to the grocery store myself.
Boy.
Because she couldn't.
Yeah.
So.
Did you say something also? You're wearing socks now.
Yes,
Yeah.
because
Somebody who's watching this who doesn't have neuropathy, what was it like for you to try and put socks on before?
suffocate your feet, and I couldn't, and I couldn't have sheets, blankets touch my feet. Nothing.
What would
could touch-
happen when
it just hurt, pain, yeah. So, and then the socks, oh my goodness, no way. But I did actually wear a pair of socks last week, the first time in 3 years.
That's when you were at the zoo.
Right.
And how long were you at the zoo walking around?
We were there all day.
Oh, Lord.
Yeah. Yeah.
Good for you. Anything else you can think of that's really something noticeable? I mean, you lost the weight.
Yes.
You're moving around. You're riding a bike. You're enjoying life again.
Yeah.
You said you're about what percentage?
About 90%, if not
9%
more.
improved, and that's
Yeah,
still continuing, and,
Right.
and it's going to get better as they take you off of these
More
meds and
meds.
everything else.
My,
So.
yeah, my blood pressures went down. Yep. Everything.
Sugar's down, blood
Sugar's
pressure's down, everything's going down.
Right. And she used to have to, we had Portland ceramic tile
Okay.
in parts of the house. And
Sure.
she would try standing on it
Because it was cold.
because
good
of
on
the
my
coldness, because her feet was that,
So that was like a therapy you would do to have to calm down
Yeah, because
the
my
fire
feet
in
felt,
your feet?
yeah, they felt like they were on
Oh, yeah.
fire.
Oh,
So a
Lord.
lot of times I would stand up and on the floor and yeah, did that in the middle of the night many times.
You were really suffering.
Yes.
Oh my
Yeah,
gosh.
no more.
Good for you.
Yes.
Anything else you could think of?
Not that I can think of.
Awesome.
Just, I'm feeling so
she's
much
just
better.
definitely so much improved.
Yes.
It's just so much better.
Well, I appreciate that. Thank you both for sharing this story, because I know darn well people are going to listen to this.
Well, I thank you for all your
You
help.
know, you did what we asked you to do.
Right.
You
Correct.
followed exactly what we told you, and these are the results that we normally
Right.
get. But a lot,
Exactly.
you know, some people don't feel comfortable giving a testimonial, but you doing this is going to help other people.
Oh, I hope so,
Right.
because why should, I hate to see people suffer.
Hey, the truth, you know, there's nothing wrong with speaking it, and I mean, we wouldn't be here talking about it if it didn't happen. And I mean, it's happening, and you know, so much improvement.
Awesome. Well, thank
It's
you
worth it.
both. Thank
You're
you.
welcome.
Thank you both very much
Well,
for
thank
sharing your
you.
story.
Thank you.
Thank you. Yeah, thank you.